thank you for having me here. Welcome here to Intercontinental in Muscat. Tonight we're going to start this session talking about the Facetem. As I'm sure all of you know, Facetem is a filler based on the calcium hydroxylapatite, which has the main goal of stimulate the production of our new collagen and restore the lack of volume, the loss of volume that happened with the aging process. So first of all, I want to give credits to Dr. Andrea Bocca and Aydin Sarai because they gently gave me some of their lecture to pass some before and after. I'm Dr. Carmelo Crisafulli. I'm a plastic surgeon based in Dubai. I'm working for Vitatech since about 4 years now. And we are starting now talking about the Facetem. So, first intro, I would like you to focus on this picture because this is a forecasting of what the patient will do in the next years. And as you can see, between 2021 and 2028, the percentage are almost the same. So, I'm a surgeon, so unfortunately I have to admit that patients and people in general, including the media, are going most through what is not surgical procedure. So they are looking for a rejuvenation, they are looking for enhancement of their beauty towards medical procedure, which are not surgical. What they ask for, the first thing they come to me for, and I'm also to you, is for the face rejuvenation. So restoring of the loss of volume, restoring of the aging process, trying to give a better appearance. So why we should use Facetem and not just an hyaluronic acid filler? We all know the hyaluronic acid. It's a stable product. There are many brands and many very nice products we can use in our practice. But with the Facetem, with the calcium hydroxylapatite, we can offer something that lasts longer, being always safe with the patient. We are not talking about semi-permanent filler, permanent filler. We are talking always about non-permanent filler. So from now on, there is no point anymore to talk about semi-permanent. Also because, let's be honest, while majority of calcium hydroxylapatite or polylactic acid, they are very good for the rejuvenation in terms of collagen stimulation, Facetem, because of its own structure, which is very particular, it's a very good product also to give volume. And we will see later, everything is related about the dilution of the product and the patient's skin quality, of course. Okay, so let's start. Why I show this picture, this image? Because the main thing we have to understand and the main thing we have to do is the evaluation of the patient. And the evaluation can be subjective and objective, but we have to be honest and we have to analyze what is the main problem, what is the main thing we're going to treat, which is the skin. We will have patients with saggy skin and thick skin, where unfortunately there is no other way than doing surgical procedure. Thank you, I'm here for this. But there are patients which are good candidates for face lifting, I would say, with this kind of product, in this case with calcium hydroxylapatite. Always balance the expectation of the patient. We know they come to us with pictures from the media. I want to be like that. This is not always possible. First of all, because we are unique. So we cannot be the same to anyone else unless we have twins. And second of all, because unfortunately the condition of the picture taken for the media, of the picture taken from this beautiful actress and actor, are full of filters, are not reality. The real life is something different, and we will see the real life when we have the patient in our clinic, not on the social media. What happened during the aging process? We will see that there was a nice picture, I removed it actually. There is a nice face with the upside down triangular drawing on the face, and when the aging process is starting till the end of our elderly life, this triangle is going to be completely rotating. So if at the beginning the apex of this triangle is our chin, giving the nice volume and contouring of our face, at the end of the aging process, the apex of the triangle is on our forehead because there is a laxity and a sliding down of our tissue. Why this is happening? Because of the bone remodeling. We know 100% that with the aging process, our bone becomes thinner. And on the same time, with the bones, also the fat pads compartment, they become smaller. This is absolutely normal. There are patients that develop this aging process earlier than others, and most of the time they are subject to hormones and skin quality. There are patients that have a long-lasting youthness. I would say some Italian like Sofia Loren that I believe all of you know. Where and how we should inject. This is a very nice picture, very nice slide, which is showing that whenever we have to give a kind of lifting, the injection should be lateral to the retaining ligament of our face. I'm sure you know the anatomy better than me. So the retaining ligament are on the temporalis area, on the zygomatic, masseterius ligament, and mandibular ligament. Whenever we want to give a lifting, whenever we want to stimulate the skin tightening, the injection should start from the lateral side. Whenever we want to give some volume or restore the lack of tissue, we have to work on the other side. If we do the cheekbones and we want to give volume, we inject on the medial part of the zygomatic ligament, not lateral. Where, how to inject? We have to start always from the upper third of the face. If we have a patient with the pre-jaw gap and the saggedness on the jawline, unless there is just a mild saggedness, we cannot work only on this compartment. We have to work also on the zygomatic area because we have to lift, we have to give the tension, and we have to create kind of support for this structure starting from the zygomatic area. So you can see here, let me see if the mouse is working. We have always to start lateral, and we have always to start on the upper third of the face. And then we can go down working on the lower structure. Aging is a multifunctional process. So there are, a deep knowledge of the anatomy is a must. During my training, during my lectures, I always try to stimulate my fellow doctors to do these cadaver labs, because this is the only way to understand really the anatomy. I studied the anatomy in the book. The anatomy I see in my surgical procedure is completely different. The book is something is written there, but the live anatomy, or the one you see touching the singular structure, is completely different. So knowledge of the anatomy is the base to understand how to restore, how to give rejuvenation to our skin. We can see from this slide how in the same patient in different areas, the aging process affects the thickness of the skin, with the loss of elasticity, with the loss of the collagen. We all see, and you are dermatologists, you know this, we all see that despite we have many types of collagen, the balance between the two major, which is the type 1 and the type 2, is going to be, type 3, sorry, is going to be inverted with the aging process. At the beginning, we have a lot of collagen type 1, which is the elastic one. Then this balance is going towards the type 3, which is the fibrotic one. Now, the good things of Facetem, which can be the main difference when we talk about the calcium hydroxylapatite and polylactic acid, for example, is that there is a stimulation on the type 1 and the type 3. But I'm very honest whenever I do the speech. It depends always patient by patient. If I have a patient of 70 years old, of course the stimulation of the collagen type 1 is going to be less than the type 3. Why? Because the amount of collagen type 1 is less. Whenever we have a patient which is a bit younger than 70, of course, there is always a very good stimulation in type 1, keeping the elasticity of the skin and giving a very natural result. Which is the right technique? For the face, I use both. I use cannulas and I use needle. It depends how you feel better in terms of feeling when you do the injection. For sure, the cannula is the safest method. Why? Because with the cannula, we don't have any, in any way we can go inside the artery. We cannot inject intravascular unless we are stabbing the patient. The cannula has a blunt tip. So breaking the wall of the vessels is very difficult. Whenever you feel an obstacle, just tilt a bit the cannula and you will go through the tissue without damaging any vascular support. Needle, for some area, for example, for the chin, the needle is the best option. You go straight to the bone, you inject, and you give volume immediately. For the cheekbones, it's the same. So whenever we have to reach the deep structure, and we have to be sure that we are on that place, the needle gives us much control because it's not flexible. The needle is short, the cannula is always a bit longer than the needle, and it can be flexible. So compared to the hyaluronic acid, the calcium hydroxyapatite has a superior lifting effect, which is happening in the 3 weeks, 4 weeks after the injection. This is one of the main differences between the two products. Whenever we use the calcium hydroxyapatite for stimulation, we cannot expect to have an immediate result. That's why our communication with the patient is the most important thing. We have to explain to the patient that we are doing something which is stimulating the production of collagen, and this is happening usually with the normal turnover of the skin, which is more or less 21 days. So whenever the patient does the injection, you start seeing the result at least after 3 weeks. And most of the time, if we have patients with saggy skin, this stimulation has to be repeated. But this is a normal procedure that you wouldn't do, for example, with the hyaluronic acid. We use mainly the hyaluronic acid to give volume and restore the jawline, for example, projection or the chin volume, but this is something you do once in your clinic, and then the patient comes back for the follow-up, and usually then you see again after 6 months, 5 months, not before. With the calcium hydroxyapatite, you can set up several injections within 2-3 months, 2-3 sessions, and the result lasts up to 2 years. So, and it's not something permanent. We will see later that there is an automatic, how can I say, melting of the products being part of the structure of the skin. So at the end, the product is exactly part of the skin without giving any foreign body reaction, without giving any granulomatous reaction. It's a very well-known product. They started in the 1990s. So basically, it's not true the fear that most of our colleagues they have that is a product which is not stable, which is changing, which can give complication. No, it's a product that if it's used properly and if it's injected in the right way, can satisfy the patient expectation and also the doctor's expectation. Now, what is the main difference of Facetem S? Is the structure, because we are talking always about calcium hydroxyapatite, but the Facetem has a lattice pore structure, which makes the filler much more stable. And we see now how the texture of the filler is different compared to the other calcium hydroxyapatite. Facetem has this reticular structure, which is stabilizing the filler inside the area that we inject. So this gives to the patient to avoid also and prevent the sudden volume loss, because I'm sure you use any other fillers like this one, and you see that immediately after the injection, usually within 15 days, the volume is reducing if you're using this product to give volume. With Facetem, it will not happen. That's why you can use also to restore the volume. Today, we will have 2 beautiful models. We will work on the jawline and on the temporal area, and you will see that when I will do the jawline, the patient will have immediate volume, and if you follow up the patient within 15 days, and hopefully Vitatech will send you some picture, you will see that the result is still there and is not changing. According to the microsphere of Facetem, this structure allows the filler to be englobated within the collagen tissue, the subdermal tissue. In this way, the filler has a longer stability, and over the time, it's completely inside the natural collagen. So it's something that doesn't give long-term reaction, something that unfortunately happened in previous patients. Just to be on the safe side, we started using this filler and the polylactic acid when I was still in my medical school with patients with HIV. And the main concern, the main goal of this procedure was to restore the huge lack of the cheek area due to the therapy that the patients were doing. Patients were literally like this. And with this filler, with these stimulators, we were able to restore the thickness of the skin because there was a natural production of collagen. And be careful, the patients with HIV are under treatment with immunosuppressive medication. And despite that, there was no reaction, the filler was safe, there was no other side effect in the long term. We can see some structure here again, how it's completely englobated without leaving much space. These are pictures made with the microscope. It's just to show you that there are scientific works about this. It's not something that we are taking out of our cylinder. It's a well-known product, it's a well-known material, and we have the chance to use for our patient, giving nice results. And compared to the other filler, compared also to the hyaluronic acid, the viscoelasticity is very, very high. You will see when you will inject, and I will show you when the camera will point the syringe, that it's like a filament. It's very, very well viscosity. The viscosity is very high, sorry, and it's a compact product. So it's not spreading around. It's stable, it's durable, and gives a nice result. Indication, we can treat the whole face. We can treat the forehead for rejuvenation. We can treat the temporalis area. We can treat the glabella. We can treat, sorry, the chin area, the neck, the jawline, the nose. I'm not a huge fan of filler of the nose, but I'm a surgeon. That's why I prefer doing surgery. And which are the contraindication? Of course, we don't treat the glabella and we don't treat the lips. No non-permanent filler and stimulator has to be injected in the lips. Why? Because the anatomy of the lips is completely different from the rest. If on the face I have my normal skin, so epidermis, dermis, superficial fascia, fat layer, deep fascia muscle, there's muscle in this case, on the lips I don't have that. I have just the skin or the mucosa, and then basically I have straightforward the muscle. And the product has to be injected in the muscle, which is under movement constantly, and it could give a stimulation. But this is only, not only solely for the calcium hydroxylapatite, it's also for fillers made by hyaluronic acid with a very high molecular weight. And according to what we have to do, we can have several dilutions. So whenever we have to give, for example, rejuvenation of the skin, for hands, for the face, the dilution usually is 1:1. We have two kinds of syringe, 1.5 ml and 0.8 ml. When you do the dilution 1:1, you can have 1.6 ml or 3 ml, which are enough to treat, for example, the 3 ml, both hands. Whenever we want to give volume, whenever we want to give tightening, the dilution should be higher than 1:1. 1:2, 1:3, 1:4, according to the skin type. This is very subjective. You can go always with 1:2 without injecting a huge amount. Now, this filler, and I did myself without having any problem, can be injected also without dilution. I don't suggest to do that mostly in the Middle East because the skin quality is not the best to have a pure product injected onto the dermis. So dilution 101 is always the best thing to do whenever you want to give a bit of volume or whenever you want to give rejuvenation. Again, two products faced 1.5 and 0.8 ml. Concentration is 30% of calcium hydroxylapatite. There is the gel carrier, what is bringing the filler into the dermis compartment, and it's 70%. The size is around 25 and 40 micrometer. The injection is onto the deep dermis. Whenever we want to give tightening, should be injected between the connection between the deep dermis and the subcutaneous tissue. If we want to give volume, if we want to give rejuvenation, inside the dermis. So we work always on the deep dermis. It's super easy. You can do a small injection of local anesthesia, creating a small lump, a small puff, and then you go with the needle. Whenever you feel the first click, you are already into the dermis. And with the cannula, you go straight there. Again, not to read everything, but it's a product which it was studied very well. There are several scientific works showing the affidability and how stable is this filler. There are no complications because of the filler. Whenever we have complications like any other injectables, these are coming because or we don't inject properly in the right plane, or we inject too much, or we inject in the wrong intravascular, or the patient didn't follow our direction. Again, evaluation of short-term outcome without any kind of complication due to the filler. there is a comparison between the other calcium hydroxyapatite, which is radiase, we can tell the name. I still prefer Facetem because it's stimulating also the collagen type 1. And now, out of the record, I hope they're not recording, they changed lately, I think lately, 2-3 years ago, the concentration of radiase. So it's not the radiase we were used to use before. And Facetem, I can tell you 100%, it took easily its place and is a very good product. Omar, the dinner is paid, huh? Again, article about the affordability of the calcium hydroxyapatite, used also for body stimulation in general, not only for the face. And we can see, from this slide, how can be used all over the body. These allow us to do also combined procedures. Some of you maybe knows me also because I'm a trainer for bioscience for CaHA Corp. I use many times the Facetem for the stimulation of the dermis to give the tightening and to make the skin a bit more firm, and the hyaluronic acid the CaHA Corp to give the volume. It's amazing on the knees. Whenever you have this very tiny skin which shows this laxity on the top of the knees overlapping the skin, this product works very well and it's not painful, it's easy to inject. The patient has a very nice outcome. Can be used for the neck with the cannula or with the needle. Try to give the right advice to the patient. Most of the patients come for the neck because of the horizontal lines. They will improve a lot, but they cannot disappear because whenever the patient is moving the neck, the lines come back again. So, but if we stimulate the production of new collagen and the skin becomes thicker, these lines are showing much, much less. So it can be used for volumization, for lifting, collagen booster, elastin booster, enhances the osteogenesis. Whenever we give the injection to the periosteum, because of the direct contact and because of the inflammatory reaction which is naturally happen whenever we inject something, there is a stimulation of the osteogenesis. Now, I'm not telling you the bone will become thicker again, but it reduces the aging process. Sometimes we cannot restore completely, but we can slow down the aging process. And this is the product that allows that skin booster and tightening effect. You will see now a video for the hands. Immediately beautiful result, and the result is shown much better and it will be amazing after the 3 weeks. Longevity, 1 to 2 years. Again, whenever we talk about volume restoration, so far there are no products that stays up to 2 years. Not, of course, I'm talking about not permanent product. But it's true that if we are able to do a biopsy and an histopathological study of that area, we see that still there is the product. Means that still some particles are there. The cosmetic effect lasts normally around 1.5 years. It's natural, it's not allergenic, and there is the antidote. Many doctors were saying, oh, but if I inject the hyaluronic acid, I can use the hyaluronidase to melt the filler. Yes, true. If you inject the calcium hydroxyapatite, you can use the collagenase. We have PB serum, which is an amazing product for that. We will use and we will see now the thiosulfate calcium, which can degrade the calcium hydroxyapatite. Worst case scenario, local injection of steroids. Reduce the inflammation in case of a complication. And the dilution, also this one, it's something that has been studied properly. That's why at the end, we find the common ground to use the filler, this filler diluted at least 1:1. First of all, because we have more product to inject, and second of all, because it's more safe. Now, dilution how? So mid-face, lower face, neck, décolleté area, cleavage, hands, upper arms, buttocks, thighs, and abdomen. According to what we want to do, we use cannula of 22-25 gauge or needle. And you will see here, whenever we want to give a rejuvenation hands, face, and the injection has to be done in the subdermal plate, we use a dilution 101. So intermediate viscosity and stiffness, and the primary goal is the restoration with easy product of distribution. Means we give thickness to the skin, we can give some volume in case of the face. Whenever we have to do tightening, skin tightening, stimulation of the collagen to increase the elasticity of the skin, the dilution should be at least 1 to 2. So if I have the syringe of 1.5 ml, I do the dilution with 3 ml. Or the best thing to do is to use a 0.8 with 1.6. So with 2.4 ml, you are able to treat both areas of the face, for example, or the hands. According to the skin, normal skin 1 to 2 or 1 to 3. When we have thin skin, because of the viscoelasticity, of the viscosity of the product, the dilution should be 1 to 4. Why? Because in this way, we avoid irregularity on the skin and still the product is there working. We just inject a bit more, but it's more liquid, so it's not going to show the crocodile skin effect. Whenever you want to give some volume, you cannot expect that if you dilute the product more than 1 to 1. Why? Because we reduce the viscoelasticity, so the filler is spreading all over the area and it's not stabilizing in that place. So Facestem for nasolabial fold. Keep in mind always about the anatomy. We have the deep piriform space, we have arteries going here. So lately I'm using myself also a cannula with the entry point from the lower third of the nasolabial fold going under the dermis and injecting here. Sometimes I use the needle only, but very careful doing the suction test, on the upper third in order to create kind of support and also perpendicular to the nasolabial fold to lift all the structure. We can see some before and after. As you see here, the before, the after is always around 30 days, 3 weeks after, because immediately you don't see much result. But with the stimulation of the collagen, this is going to happen, and there is a very nice reduction of the nasolabial fold. Dilution can be done, sorry I didn't say that, with lidocaine or with sterile water, with saline water. The thing is, if you inject only the saline water, the physiological water will not burn. If you inject saline water, it might burn a bit, according to the concentration of the chloruro, or sodium chloruro. With the lidocaine, never put the epinephrine, in my opinion, mainly whenever we do hands or feet, never put adrenaline or epinephrine, and might burn a bit more because the lidocaine burn when they enter in contact with the dermis. Again, nasolabial fold correction, 1.5 ml, second case, 90 days after. Same patient of before. 30 days, 90 days, sorry, get stuck here. Okay, here is the other patient. In very nice reduction. This time 0.5 ml with the dilution 1 to 2 and 25 gauge cannula for the injection. 30 days after, improvement, marionetta lines, before and after. We can see also how the patient has a different skin condition, a different skin quality. It's a product that can be used on all the skin quality. Of course, expectation is always relative. It's not going. Malar region. For the malar region, we will do today. It's very important to avoid, of course, the artery and the nerve, the facial nerve. So we draw a line from the corner of the nostril till the middle of the trachus, and from the lateral canthus till the corner of the lip. In that triangle, we can do all the injection. Now, with the cannula, we do an access point from the upper part of the zygomatic area. We touch the bone, and we go with the cannula on the periosteum. Pre-periosteal space, yes. We can see some result here, okay, how it gives volume and how is improving also the lifting of the face, reducing the nasolabial folds. 7 days later, 60 days later. The filler is there, and now you can see how the curve, if there is the picture, yes, temporal, for the temporal region, always with the cannula. It's very important to use the cannula of the temporal region. You might struggle to go with the cannula because there is an overlapping of the superficial and the deep fascia on the lower part of the temporalis area. So in this area, you make the just entry point always on the bone, on the zygomatic bone, and then you go up with the cannula, injecting in this area. And it's a very good product to restore the volume, giving again the oval shape of the face. As you can see, it's always basically the 1.5 ml, which is diluted and allows you, how many times you use the hyaluronic acid and one syringe wasn't enough, and you have to charge more to the patient. In this case, with one syringe, you can treat more than one area and giving nice result to the patient. Okay, 6 months after, the temples are still there, and there is a nice improvement of the volume and the skin quality. Chin. When we do chin augmentation, in this case we have a beefy chin deformity. We just correct injecting on the middle part of the chin, and you can see how the projection is changing. When we want to give the chin augmentation, entry point in the middle, we give the dilution 1.5 to 1.5, so 101, and we restore the volume. And this is something that we see immediately. Sorry, the slides are getting crazy. Let me see if I can. Okay, again from the side, nice projection. Now, let me see if I can have the, okay. I want to show you something. We should draw a line from the tip of the nose perpendicular, and if you rotate this line, you see that it's going to touch exactly the tip of the chin going through the lower lip. In this way, the projection is right. In the first one, if you do the same with the line, it would touch the upper lip. Means that the chin needs a bit more projection. I love to do chin filler. Honestly, it's a very nice procedure. We change the patient face immediately in a nice way. You are a dermatologist, you have a lot of patients with acne scars to treat. So in this case, dissection under the skin and immediate injection of Facetem will stimulate the production of collagen, as we said, improving the skin quality. It doesn't remove the scars. It will reduce the hollow part of the scar itself. Then multiple other approach with laser, with peeling, or whatever you like, of course, you give a better result. But combination is a must lately. For the hands, I will show you a nice video. I hope you will enjoy. If we will start, yes. So good evening, doctors. Today we're going to talk about Facetem. Facetem is a calcium hydroxylapatite filler that, as you know for sure, it's a product which is naturally stimulating the production of new collagen in fat. We use the Facetem S, which is the one with the right concentration, and we have actually two kind of syringe. The first one is with 1.5 ml, which is useful whenever you have to give volume to the face, for example, nasolabial fold, marionetta's line, pre-jaw gap, jawline itself. And the other one is 0.8. If you don't mind, I will skip straight to the part where I treat the hands. As you can see, there is a syringe which is the same, 1.5, but it's filled only for half. Why this? Because this product can be used also as a biostimulation. Today we will see in our beautiful patient how we treat the hands. When we treat the hands, the dilution can be done 101, means if we use the syringe of 0.8 ml, we will use 0.8 ml of saline or lidocaine. For the hands, I suggest only saline. And in this way, we will have enough product in order to stimulate the full hands and create a new rejuvenation of the skin. It will take around 3 to 4 weeks to see the final result, and according to the age process that the skin has already, to the wrinkles or to the thickness of the skin, we can plan 2 or 3 sessions within 1 month of interval between them. So let's see now how we're going to do the dilution. We will start today with our hands. I'm using the 0.8 ml, 1 per each hand, which will be enough to treat our patient. Okay? Let's see. So here we have our beautiful Rim, our model for today. May I ask you something, please, Rim? How old are you?
43.
She's lying. She's 36 in the reality. Anyway, as you can see, she has quite dry skin on the hands. I asked her before, are you using a lot the hands? She said, yes, because of my job. So we are going to do a rejuvenation of this hand. Usually 1 entry point is enough. I will use here the syringe, the Facetem S 0.8 ml diluted 101 with the saline. So in total will be 1.5, 1.6. 1 syringe will be enough to treat 1 hand. So for both hands, we're going to use 2 syringes. We could even use the syringe of 1.5 ml, diluting with 1.5 ml of lidocaine, and we use 1 syringe for both hands. I like to do only 1 entry point, which usually is this point. It's super easy. You ask the patient to bend the wrist, and you feel a small gap under your finger. This is the safest place. We will use a cannula of 21 gauge. 7 centimeter or 5 centimeter cannula, and from 1 entry point we will treat the whole hands. So always we do a nice disinfection of the area, not only the entry point. Let's do disinfection on the whole forearm, okay? We have to be safe. Entry point, so if we ask the patient to bend the wrist in this way, you can immediately feel here a small depression, okay? This is the space between the joint. And there is one more on the radial side, which is here.
Check always if there is
I'm
a
going to
vein
use
underneath.
this one,
Use one
because
or the
from
other
here
one.
it will be easy for me to treat the whole hand like this, okay? One small injection of anesthesia. Always check if there are veins, superficial veins, so we avoid to inject where is the vein. I use lidocaine, plain lidocaine without adrenaline on the hand. It's very important. Do not use epinephrine or adrenaline whenever you inject the hands and feet, okay? Thank you very much. Let's go like this. Can I have the injection of the anesthesia, please? Do you have any allergy?
No.
Have you done local anesthesia before?
Yes.
Very good. So 1 small injection of local anesthesia, it will burn just a bit. It will be 1 millisecond. 1, 2, 3, 6. Suction test. Okay. Nothing. Let's do it. You good? Fine. Thank you very much. We wait 20 seconds for the anesthesia to work. I make a small bubble. So we did the local anesthesia. I clean the area. I do a small pinch with the needle. Okay, lifting a bit the skin. 1, 2, 3. That's it. Pain? Of course, there is the anesthesia, so there is no pain. Okay, and we start with our filler. We prime the cannula. For the injection, the best thing to do is having a full stretched skin. So we ask the patient to go a bit further with the arm. I enter from here. I tilt and I start my injection. Tell me if you feel anything. In this way will be super easy and smooth. Okay, sometimes the patient feels something because there is a small vein, so we avoid to break it and we go around. You can see I'm reaching already my place and I start my injection. You might feel a bit of burning, It's normal. You okay? I change the direction, I reach the other place. Okay. I change again. I go close to the interspace between the knobs and I do my injection. Good. If you feel a small obstacle, just tilt a bit the cannula and you go through. There you go.
Okay. Any pain? Okay, done. Can I have another gauze? I will apply all over the hand and we do a nice massage following the radial injection that we just did. We're using an antibiotic ointment, so we are safe. Okay, you can spread also on the entry point. Go a bit back. We do again. You okay?
Inform the patient that if they have any pets, dog, cat,
Explain to the patient that if in the
to avoid to pet them for the next
days
24
after
hours
she
after
feels
the
or he
injection.
feels some small lump on the surface of the skin, it's just enough to massage in this
because
way.
of the risk of infection.
Yeah, if you feel the lump, okay? This is the immediate after result. Can I see the other one? Put one next to each other, look the texture. This is still very, very dry. This one, if you put one next to each other, I think there is already a big difference. It will improve in the next 3-4 weeks. This is, of course, it's an effect that we got because we feel the area. But because of the dilution, our main goal is to stimulate the production of new collagen and elastin. And this one will happen following the normal turnover of the skin, which is around 21, 28 days. So 3-4 weeks. Okay? Thank you very much. So we just finished to do also the left hand. As you can see, it's a nice result. The skin appear immediately more moisturized, but again, it will improve in the next weeks. Now, very important thing, when we don't have to do any kind of hands procedure, not only this filler, but also the others, this collagen stimulation, but also the others, whenever the patient has any skin condition, psoriasis, keratosis, skin cancer, precancerous lesion. Whenever the patient has anything like that, we don't do any hand filler, any hand stimulation. When the patient has arthritis, we don't do it because we are gonna make the skin better, creating an inflammation. If the patient has already chronic autoimmune inflammation, which is the arthritis, we can cause damage. Whenever the patient has a Raynaud syndrome, which is the vasoconstriction of the vessel, we don't do any procedure on the hand. In this case, she is nice, beautiful, and healthy, so you can put all the hands one next to each other. As you can see, they look immediately better, and I'm curious and very happy to see you after 3 weeks to see the final result. Thank you.
Okay, let's see other before and after. Here you can see immediate volumization of the skin, same here, same here. Complication, I will be quick because of course we have another presentation. They are the same complication of the normal hyaluronic acid filler. So you can have immediate complication and late complication. The early adverse events usually happen in between the first 2 weeks and the late adverse event after the 2 weeks. Technical errors, if we inject in the wrong place, this is our fault. Infection due to the patient or due to our fault because we don't disinfect the skin properly. I saw many nurses cleaning the skin with the saline, not with the disinfectant. This is one of the causes of the infection. Hypersensitivity reaction like erythema, edema, and angioedema. Hypersensitivity reaction type 4, ulceration, nodule, vascular occlusion, and skin discoloration, the Tyndall effect. Tyndall effect is transitory, just do the small massage and will disappear. If you have vascular occlusion, means it was an error on our technique. Huh? And again, we have to be very careful with the area of the injection, avoid labella, nose, and forehead, because there are arteries which can be eaten very easily. Central retinal artery occlusion, just be careful when you do the tear trough filler. Be sure that you are under the muscle and be sure you are not going very, very strongly with the cannula. Needles should be avoided in this area because you have major risk to give this kind of complication. In some cases, the occlusion can come later because you see just some blister after a few days and the whitening. I'm not a big fan of EMLA because the EMLA creates an inflammation and a whitening of the skin. So sometimes you can get like confused by this. But still, if you massage strongly, if you pinch and then you release it, you see if there is the occlusion or not. Slow injection to prevent, slow injection force, so do not pump too much, don't push too much. Do not inject bigger amounts. Try to be always as much natural as possible. Do the suction test, aspiration test. Of course, if you're using the needle, there is no point to do with the cannula because the entry point, the exit of the filler, it's behind the tip. For deep injection, choose always the pre-periostal plane, which is safe. Avoid large bolus. And if you're using needle in the danger zone, do always the suction test and inject always over the periosteum. Sometimes happen that you go to do the cheekbones and you go through the vein or through the artery. It's fine. You are not injecting inside. It's important the tip is touching the periosteum. She will have a bruise. Just give a compression with the ice pack. We should avoid large caliber needles, and small caliber needles are risky. Why? Because you can hit also the tiny vein or the tiny vessels. The traumatic cannula, in my opinion, are the best option whenever we have to restore the volume of the face or give the tightening. You will have this slide and you will see how to treat the single complication. Let's go further. Okay, sorry. And only one thing, last thing, and then we go with the practice, if I get it. Yes. Can we dissolve the calcium hydroxylapatite? Yes, we can use the sodium thiosulfate, which is a calcinose treatment agent, which is melting the calcium hydroxylapatite. We can use the collagenase whenever we have nodules due to collagen type 3 stimulation. Saying that, thank you very much. Let's do the practical. The question we will do later. There we go, let's start. So, our beautiful question now, plan is to try to stimulate the skin to give a bit of light of the jawline. So, can you hear me now? Okay, I will talk from here, I will do the injection from there. In this case, I'm using, because we are planning to do more than one session, so after 1 month, after 3 weeks, you will do another session, the Facetem 0.8 with dilution 1 to 2. So I will use a 1.6 of dilution, and I do 1 ml of saline and 0.6 of lidocaine. In this way, the patient will not feel any pain. I don't do local anesthesia on the area. After I do the drawings, can you show the jawline? Show the jawline on that side. Look there, look to your left. No, the patient, look to your left, other side. So I mark always the corner of the jawline, the mandibular angle. I make a straight line, and as you can see here on the pre-jaw gap, this is a transition area because here we have a retaining ligament, okay? And it's very important to not go with the needle in this area because there are arteries and there is also the facial nerve, the mandibular branch of the facial nerve. So the goal is to do a straight line from the lateral canthus perpendicular to the jawline. I will do the entry point from the middle and I will work with 1.6 each side. 0.8, 2.4 will be, yes, 1.2 each side. I will work on both area in order to give the stimulation. So I mark always, whenever you want to give both, will go like this, and I will go like this, reaching this area with the cannula. So I will pass under. I'm disinfecting the area. Okay, lay down, like this. Relax, you will feel just one pinch here, okay? Okay, so my entry point is exactly perpendicular to the bone, so just a bit above this line I draw. Small pinch. I'm touching the bone now. I'll go out. She's not even bleeding. Thank you very much. I want to show you something. So I'm having here the alcohol. We prime the syringe. Can I have sterile? Can you see here? So with the dilution, the filler create kind of. Can you see? No, you cannot see. You can see the viscosity, not so much because there is the light. Anyway, it's a good gel and it's a coated. So entry point perpendicular, I'm on the under the dermis, I tilt my cannula, just relax. I'm going under the dermis. Are you okay? You will feel a small click because I'm going through the retaining ligament of the jawline. Okay. I'm here on the corner and I start my injection. Retrograde injection. I go back following the triangle I drew before. Then I go out, I tilt my cannula, and I go on the pre-jaw gap. Relax, you will feel a click now, a bit of discomfort. Yes, I'm crossing the ligament now. 1, 2, 3. There you go. Are you okay? Any pain? No pain, no gain. Okay, I'm here on the pre-jaw gap and I finish my injection in this way. The first one is gone. Massage. On one side, you okay? Okay. Four, small slit, about 1 centimeter above the mat. 1, 2. Okay. And now we use the left hand. Now, in the cannula, there is here, as you can see, this arrow which is indicating the exit point. Considering that we have to inject subdermal, this arrow should be always projected upwards. So we are injecting basically on the base of the dermis, in the deep dermis.
show here. And the picture that is all. Okay. It's normal. There is one side which is always more sensitive than the other.
No, but that's
Okay. You feel something underneath. Swelling is normal for the first 24 hours. Then, when the swelling is gone, the patient will start seeing the proper result. Definition of the jawline. Definition of the jawline here. Okay. I will see you next year. Just keep it there.
Of the after now, and we have to compare if you can follow up the patient after 15 days or after 3 weeks, and then after 60 days. And you can do the second session after the first month, and you will see how the result will gradually give a bit of tightening of the skin. Of course, it's not a facelifting. There is the weight of the skin and the relaxation of the muscle, but it will improve a lot the skin quality. And mainly from the right side, there is a nice definition of the jawline. Check the other side. Nice. Thank you very much. Any questions?
I saw also dilution ratio. It is 1 to 5 if we have atrophic skin.
If you have very thin skin.
Yeah. What if we have atrophic post-burn scar and we need to add volume to lift the skin? What will be?
The thing is that when you have to lift for the scar you are talking, right? The problem is that the scar is a depression because there is fibrotic tissue pulling down the skin. So the main thing you should do is, of course, the dissection. You use the needle or whatever you want, and then replace immediately, not the volume, because you are not able to lift the skin up. There is still the fibrotic tissue. The skin is still heavy. The goal is to stimulate the collagen. These products are not for an immediate effect when we talk about stimulation. It's something that will happen in the next 3 weeks. This is the worst challenge we have with our patients because they come to us and they do like this, I want to have this. It doesn't work. We have to explain that it takes time. And everything, in my opinion, whenever we treat the face, takes time. We cannot, we can do the lips immediately. But even the lips, after 10 days, they are better than the first day of the injection. So it needs time to work. What is the thing? Is it the best thing to do? And this is a big question mark. In some patients, it works very well. In other patients, it works a bit less. It depends always by the skin quality.
If it's a depression of the skin due to volume loss, how will be the ratio of the dilution?
If you have to do volume, so if you have to replace the volume, it's 1 to 1. If you go for more than 1 to 1, you cannot add volume. You can go, but because there is an official statement in which say calcium hydroxylapatite, polylactic acid, it has to be diluted, we do 1 to 1.
And for rejuvenation and the hyperdiluted ratio, what is the recommendation if the 3 months, 6 months, 1 year?
Okay, whenever we give stimulation of the skin, we set usually 2 or 3 sessions with the patient. The recommendation we give to the patient are always the same, to take care of their skin. First of all, the sun damage is mostly in this area, is what caused the worst problem with the skin. Why? Because even when it's raining, even when it's not exposed to the sun, the UVA are going deep to the dermis, affecting the collagen, the elastin. So the best thing is always to protect the skin. Then, why this product is good? Because you can use in combination with other products. I showed the slide in which after a few weeks, the product is completely integrated with the skin. Means you can use machine, radiofrequency, or something else to stimulate the production of new collagen. So you do combined procedure. You can do the PRP, which is another very nice procedure to improve quality. While if you put the hyaluronic acid and you feel the bone, the bolus, let's say, of the hyaluronic acid, and you use the HIFU or use any other machine which produces it, you melt the hyaluronic acid. With this one, it doesn't happen because it's stimulating. It's not giving the volume. The main concern, the main goal of this product is to stimulate. And that's why still, even if these are amazing products, the main use in our facility is the hyaluronic acid because the patient wants immediate volume, they want immediate result. But in my opinion, and I am a surgeon, this is the future. This biostimulation is what really keeps the skin healthy. This is my humble opinion. So the advice to the patient is to follow you, to follow your direction. Explain to the patient one session is not enough. We do 1, 2, or 3 sessions. We will see after 1 month how the skin is. Picture before and after will help you a lot. Most of the patients you saw here for volume or for rejuvenation, 1 session is enough. But in this case, for example, I know 100% that 1 session cannot be enough because there is a relaxing of the skin. With the time, she will improve a lot. If she want to do something else to improve the skin, after 2 weeks, she can do it.
Thank you.
Thank you. Yes, doctor.
Thank you a lot for the presentation, but my question is for like the perfect combination for biostimulation is 1 to 2, the dilution.
For the rejuvenation is 1 to 2.
1 to 2, and then if it's combined with energy-based like devices like microneedling, so should be before or after?
Well, this is the same thing. Actually, you can do even on the same time. I suggest always to do the mechanical injury before. You wait a few days and you do then the injection. Why? Because the biostimulation with the microneedling, for Vivaci, for example, it's a combined radiofrequency with microneedling, create an inflammation. This is how it works. So if you inject while there is already the inflammation, is not the best thing. I usually suggest 3 to 4 days to calm down the inflammation, then you can do the procedure. But actually, when I do the protocol with my beauty therapist or my dermatologist, I keep an interval always in all 15 days. For example, I do PRP or Vivaci. After 15 days, I do this. After 15 days, the second session of the PRP. After 15 days, the second session of this one, which is 1 month gap in between. After 15 days, the third session of PRP. So why this? Because the average turnover is around 3 weeks of the skin. 15 days is enough to stimulate and to keep the inflammation going.
And any like protocol about the hybrid filler, like to mix it with a hyaluronic acid filler in the same procedure?
It depends. It depends by the skin. It depends by the reactive skin of the patient. The problem is, for example, when I talk about buttocks augmentation, I could inject 40 syringes in 1 session. But more inflammation I create, more absorption of the product I have. So at the end of the day, the result, if I do everything on the same time, will not be 1 times 2 equal to, will be 1 plus 1, 1.5, because I lose something. So I suggest always to wait and do the several approach, but wait a period of time between the sessions.
Thank you a lot.
Thank you. Yes.
Hi, doctor. I have a question, please.
Don't see you. Doctor, yes.
Hi. In your presentation, you mentioned that one of the good aspects or pros of calcium hydroxylapatite in general is osteogenesis.
Yes.
Don't you think that this could have an unfavorable effect when it comes to injecting on the nose, for example? Thank you.
This is a tricky question, doctor. I don't like injection on the nose at all. Why? I'm being a bit stubborn now. I know the anatomy of the nose very, very well. And nowadays we are going towards the preservation rhinoplasty, so trying to keep the structure as much natural as possible. So whenever you inject something on the top of the nose, first of all, the space that is occupying mainly is covered by the cartilage, so you will never touch the bone, okay? So, okay, if you go on the upper part, you have the bone, but you have only the middle line of the bone. The plate is vertical, so the stimulation of the bridge here will not work too much with this product. There are products which can be injected, made for this reason. But very honestly, whenever I have something like that, trauma, for example, I work always with the ENT, because everyone has his own responsibility. I do the grafting, I do everything, but I don't like to inject product on the nose, also because the nose, due to the movement that you have 24/7, even when you breathe, it's spreading everything around the pyramid. So it's not possible and not always easy to keep the product exactly in one place. I did many injections with the cannula, correction of the hump, lifting of the tip. Honestly, 15 days after the patient was coming back, I don't see much result, my nose is swollen. Then maybe I'm not good on that. But I don't suggest to use this product to create a stimulation of the nose area. Yes, there is another doctor over there.
Thank you for presentation.
Thank you.
And I want to ask about if we can mix with hyaluronic acid or not, and if can mixing, how to use and how the dilution, or how to use it.
Not mixing together in the same syringes.
But I think some doctors make these procedures before.
Yes, but you lose the rheology of the product because you are creating two stimulating products together. And the hyaluronic case, it has a completely different rheology. The structure is completely different. So at the end, what is the main characteristic of the product, the viscoelasticity, is going to be lost. Now, I use combination of the products mainly for the body, but they are injected in two different planes, not on the same plane. Because, for example, going back to the butt augmentation, the buttocks filler, it goes on the subcutaneous tissue, on the fat layer, while the calcium hydroxylapatite can go on the dermis. So there are two completely different layers which are separated by the fascia.
Okay, thank you. So we can use in the same session, but in the buttock, but not mixing together.
Not in the same syringe, not mixing
Not
in the same plane. They go to in two different areas, yes.
Okay, thank you.
You're welcome.
Thank you, Dr. Caramello.
Thank you very much.